Breast reduction, or reduction mammoplasty, is a surgical procedure to reduce the size of the breasts. For women with heavy breasts that are too large for their frame, a breast reduction can be truly life-changing. Some women who have never been comfortable in swimwear, workout clothing, or formal wear feel completely transformed after breast reduction surgery. Many women also have alleviation of back and neck pain, which significantly improves quality of life. Most women who experience breast reduction surgery look and feel lighter. They also have increased mobility, so activities like yoga, running, and other physical activities can be done with comfort and ease. A breast reduction reduces the size of the breast, but it also enhances the shape and beauty of the breasts. We use a superior-medial pedicle vertical reduction mammoplasty technique for the majority of our breast reduction patients. This technique, popularized by plastic surgeon Dr. Elizabeth Hall Finley, improves the projection of the breast, making the breast look perky and youthful with a long-lasting result. In some patients, this technique can also eliminate the need for a long incision under the breast that can sometimes be visible in swimwear or low-cut clothing. Breast reduction surgery always includes a lift. The result is not just smaller breasts, but breasts that are lifted with aesthetically ideal nipple position. Some surgeons promote methods of breast reduction and lift that do not include a vertical incision. This circumareolar technique does not improve the breast shape and limits the amount of tissue that can be removed. The technique can cause flattening of the breast, thick scars with pleating of the skin around the areola, and stretched, enlarged areolas. For most patients, the trade-off of the vertical incision for a beautiful breast shape with good scar quality is well worth it. Women, understandably, would like to avoid what is called the lollipop scar, which goes around the areola and vertically from the bottom of the areola to the base of the breast. Sometimes, there's a small extension in the inferior mammary fold. In our practice, we use careful surgical technique and postoperative protocols to limit scarring. We offer all patients complementary laser treatments or microneedling to accelerate the fading of incisions. In most cases, the incision will fade to a fine line that is barely detectable by 1 year post-op. Women often ask if their areola will also be reduced. It's very common for women to want an areola reduction with a breast reduction. This can be performed on one or both breasts depending on a woman's anatomy. Areola that are smaller and in proportion with the breast can make the breast look more youthful and aesthetically pleasing. Women sometimes wonder if insurance will cover breast reduction surgery. In some cases, when there's a very large volume of breast tissue to be removed, insurance may cover the cost of breast reduction procedures. These procedures are performed in hospitals or facilities designated for insurance-based procedures. In order for insurance to cover the surgery, a specific amount of breast tissue must be removed as determined by the insurance company, not by the surgeon. Sometimes a woman is left with smaller breasts than she had hoped for, or with a flatter and less feminine shape. Medical breast reduction is different than aesthetic breast reduction. An aesthetic or cosmetic breast reduction is not just about making breasts smaller, but focuses on the appearance of the breasts, making them look and feel more youthful and attractive.